sponsored by Springfield Clinic. Okay, in studio today we have Jenks from the Springfield Clinic. Sierra, thank you for being here today.
Thank you for having me.
Yeah, of course. We're talking about something very important and something that, we usually really don't talk about, and that's hand therapy.
Yes.
First of all, just explain to everybody what exactly is hand therapy.
So it's rehabilitation of any injury or dysfunction of the upper extremity, so the hand, wrist, elbow, or shoulder.
Okay, and I'm sure a lot of people at work, office jobs, things that we do, having to hold iPads
Absolutely.
and phones all day, you get those cramps and things like that in your hand. Do you see that more common in just people with, desk type jobs, or is there any specific occupation?
It's very common in desk jobs. People
Okay.
using keyboards and mouses for extended periods of time, staying in static positions with their arms.
Yeah.
Yeah, we get a lot of those cumulative trauma type disorders causing numbness, tingling, pain, weakness.
Yeah.
Yeah.
Men, women, who do you see it more?
Both.
Both,
Yeah.
yeah. So tell me a little bit about some of the things that people can do to, prevent that from happening.
So if you do have a desk type job, getting up and moving around frequently, having good position of your desk so you're not really bent arms or really straight arms or having to reach sideways a lot, but having things kind of close together, and just taking breaks. I mean, we get to work for 8 to 10 hours a day, and we're staying in the same position, and it's just not good for our bodies. We're made to move.
Yeah. Well, if people end up having to come see you because those pains are just, too just unbearable.
Right.
Just talk about what do you guys do, the services you provide?
So we provide just education, first of all, on what's causing their issues, what's going on, things that they can do to change it, stretching, strengthening. We base it on the specific person, so I can't give you a cookie cutter explanation for everybody, but we kind of listen to their needs and tailor a program for them.
Yeah, now everybody uses their hands every
Absolutely.
day. Just talk about the importance of just, being mindful and taking care of yourself if you do get those pains.
So a lot of us push through pains a lot too until it becomes an unbearable issue, and then they're harder to deal with. So if you are noticing some issues, work-related or non-work related, just checking in with your physician to begin with, and if they think it's an issue, they'll send you to see us, but just not waiting so long until it becomes a really big problem, because then it's harder to deal with later on down the road.
Yeah, of course, some great advice there. Now, if anybody wants to contact you or reach out, how can they go about doing that?
Well, they can always call the Springfield Clinic, and we can give them a call back, or just speaking with their physician first, and then they'll send us a referral to see them and address any of their issues.
Okay, perfect. Sierra, thank you.
Yes.
All right, coming up next.